Hi guys, so this video is about hamstring strains. I'm going to look at what happens when you strain a hamstring, the grades of hamstring strains you get and how that relates to healing times, so what you can expect from a healing time. And we're going to look at your symptoms to make sure that you haven't actually done something different from a hamstring strain, and then also at treatment. And with treatment, we're going to look at some exercises and stuff that can be useful and some treatment modalities that you should not be using within the first 2 weeks because it can actually make it worse. My name is Maryke. I'm the physiotherapist from sportsinjuryphysio.com, where you can get online physiotherapy treatment assessment as well as treatment for your injuries. And yeah, if you've got any questions, ask them in the comments. This was originally done as a live stream, but due to having a new computer and not having enough prep time, it was quite horrendous. So if you're seeing this video for a second time and thinking, why is it slightly different? I just felt it was too bad. I had to make it better. But yes, so please feel free to ask questions. And if you want me to help you with the injury, just the website's address is in the description of the video. Good, let's dive right in. So let me just get the anatomy picture up there. If we think of the anatomy of the hamstring, this is a picture of the back of the leg. So the nice chunky muscle there at the top is your glute max. And then you'll see the 3 yellow arrows. Your hamstrings are made up of 4 muscles actually. So the ones on the inside of the leg, the 2 arrows that side, is semimembranosus, semitendinosus, and then the big arrow on the outside is pointing to biceps femoris, which has 2 heads, so it counts as 2 muscles. It's got a long head and a short head. The most common one to injure is the biceps femoris, and then less common is the membranosus and tendinosus. It doesn't matter which one of these you injure, they all roughly take the same time to heal depending on the grade of tear you've given them. Now, they run from your sit bone at the top, so let me just get me in here. So you know this bone that you can feel when you sit on your bum? Which way am I moving? It's always the wrong way around. Just there, that's where your hamstrings originate from. And then they go down the leg and they come, the tendons eventually come and really, whoops, where am I? Wrap round the knee and even come around the front of the knee. Let me use my other, which knee is the best knee now? There we go. Why am I so confused today? So it comes round and comes and attaches to the front here, and this one slightly more to the side onto the ITB as well. Now, you also have your sciatic nerve run right through the middle of the back of your thigh. It comes out there by your sacrum at the top, and then it runs through your glutes, through the piriformis or under the piriformis muscle, and then in between the hamstrings. So any injury that affects the hamstring muscles can also irritate the nerve. But vice versa, if the nerve's not happy, that can lead to a hamstring injury, and I'll talk about that a little bit more in a minute. Okay, so I think we can move on from anatomy and we can look at risk factors. So what are the risk factors for injuring your hamstring? The first one is if you're tired, so fatigue. When they look at when hamstring injuries happen, it's always towards the end of a match or somebody who's trained really hard, so you could get that they towards the end of a training session. Yes, of course, you get the sprinters who pull up short with a hamstring strain when they just sprint, but that can be due to other causes, some of the other risk factors. So make sure that you're fit enough for your matches. Make sure that you don't push your training further than what you should. Listen to your body, so ease into it and be responsible with how you build up to it. And also make sure that you recover properly between sessions. Then a previous hamstring injury does predispose you to another one. And that's why it's so important to get your rehabilitation right and make sure that you strengthen it up properly and address the cause of your hamstring injury. And then lastly, you've got neural tension as a cause as well. Now, what's neural tension? So remember I said that your sciatic nerve runs down the back of your leg. Your nervous system is continuous from your brain, connected to the spinal cord, and then it runs into your peripheral nerves that runs in your arms and your legs. When I first studied physiotherapy, I had it kind of the picture that I had of nerves in my head was like really tiny little electrical wires. But actually, nerves are quite thick things. So your sciatic nerve is about the size of your thumb. That's how thick it is. And if you think of the size of your blood vessels, each one of them has a nerve running next to them that's roughly the same diameter. So nerves are quite, they are robust structures. They're really strong. But because they're continuous, as we move, they're meant to slide. So if you think of me running and striding out with my leg, my sciatic nerve is meant to slide as I do that. Now, if it is stuck somewhere, so for instance, say you've got a really stiff lower back, or your glutes are really super tight, or you've got a disc or something pressing on it, then it won't be able to slide freely. And then it will be restricted. So when you then stride out, instead of sliding, you're going to stretch the nerve. And nerves don't do well when you stretch them. And there's some indication that when you struggle with chronic hamstring strains and you're trying to rehabilitate, but it just keeps on coming back, you may have low-level increased neural tension. And you may not even have pain from the nerve. It may be so low level that you don't know about it. It's just when you do the test. Now, it's quite easy to test for, actually, and I do that often with my online patients as well, because you can see exactly what somebody does in front of a camera. So let me just position myself properly. How we test for increased neural tension is we're going to put stretch on the whole nervous system. And if you think of it running from the head to the tips of the toes, this is a fully stretched position for the nerve. So full neck flexion, slumping down, straight knee, and then bringing the toes up as well. So there are steps to this. You put your hands behind your back, then you put your chin on your chest, and then you slouch down as much as you can. It's not leaning forwards, it's actually rolling into a little ball, okay? Then you hold that position, make sure your chin stays on your chest, and you straighten one leg out. Now, if you can get your knees straight, you can also bring your toes towards you. And I can feel in this position a nice pulling all along that bit. Now, that pulling can be due to your hamstring muscle or your calf muscle, or it can be your nerves. So how do you know which one it is? And what happens is, if I lift my head up and that pulling decreases, it means it's the nerve that's causing it, because I've given the nerve slack and now it disappears. But I haven't moved anything with my hamstring, so it can't be the muscle that's changed. So if it changes when you put your head down and up, it's more the nerve. If it doesn't change, it's more the muscle. So you may find if you're really stiff or tight that you can't even get your knees straight. Now, if in that position you lift your head up and your knee can go straighter, then that means again it's the nerve. If it doesn't change it at all, it's just your hamstring that's tight. But a physio can walk you through all of those steps easily and help you identify exactly what it is. Also, the other thing I have to say is neural tension is quite easy to fix. It's not a problem. Once you know that it's there, you need to just investigate where the problem is. So if it's the lower back, you can do mobility exercises for that. A physio can loosen it off for you, but I find exercise is often enough for that. If it's the glutes, stretching and mobilizing the glute area can be useful, and then just following it up with neural slider exercises. What I will say is, if it's tight, don't go straight into using the slump position as a neural slider. You will make it worse because it's still stuck. You first got to unstuck it or unstick it where it's stuck. Okay, so that's just a short thing on neural tension. So, continuing on. Grading system of hamstring strains. And this is interesting because they're now starting to show that you can actually kind of predict how long an injury is going to take to heal depending on the grade of muscle tear you've got. I have to say, you see robust numbers like 8 days and 15 days and stuff on there, but actually it's a sliding scale. The 8 days is what the mean most people will take, but there are people who recover quicker and there are people who recover much longer, and I'll get to that in a minute as well. So this grading scale is the one that they used or established in the last consensus study they did, where they got together in Italy and experts from all the world or around the world decided on a system. You will see other systems of muscle tear grading as well. I know the British Athletic Association has their own scale where they look at what part of the muscle is injured as well and scales that into that, because they can be so specific with how they scan things that they can predict healing times and manage it slightly differently. That is really useful if you've got a wonderful team of physios and sports docs around you to help with it. But this grading system is more than enough for anybody who just wants to help themselves or just who's not a top athlete, to be honest. So grading scale 0 to 3. Now, grade 0 is an interesting one because in a study that a researcher called Ekstrand and his colleagues did, they went and looked at, I think it was 23 European pro clubs, and they looked at them over a couple of years, all the hamstring strains they got. They scanned 299 of those hamstring strains, and what they found was that 70% of them were grade 0 strains. Now, a grade 0 is where when you scan it, you see absolutely no injury to the muscle fibers. So the muscle fibers are all intact. So technically, there isn't a tear. You may see a little bit of swelling, but you don't see any blood and you don't see any muscle fibers torn. Now, how on earth does that happen? Because it's still painful like all hamstring strains. The player pulls up short. They can often continue to play with this, but it acts like a hamstring strain. There are a few theories, and they don't quite have a definitive answer for this yet. One of them is that the type of injury that happens in the muscle is just of such a small magnitude or such microscopic changes that you can't actually visualize that on an MRI scan or any scan that we've got at the moment. A second opinion is that actually that injury is not to the muscle, but that it's to other types of tissues, like the nerve, for instance. Or sometimes that it's referred pain from other structures, like the lower back, or again, the neural tension thing. And they found that 50% of their athletes who had the 0 grade tear recovered with between 8 and 15 days. But the other 50% either recovered quicker or took longer than that. So it took 3 weeks or longer to recover. So you can see, even if you have a grade 0 tear, it can still take 3 weeks or longer to recover. Now, grade 1, if you look on an MRI scan for grade 1, you've got a few muscle fibers that's torn, but usually an area smaller than 5 millimeters. There may be a little bit of bleeding, there may be a little bit of edema. These guys recover quite quickly as well. The mean return to play time is about 15 days. But now also remember, this is not 15 days of sitting on the couch doing nothing. It's 15 days of doing the correct treatment to get that muscle strong enough, because as soon as you tear something or injure something, its strength decreases. And if you don't strengthen it back up, you will just re-tear it again. Grade 2s, if they look on MRI scan, has more than a 5 millimeter area that's muscle fibers that's torn, but the muscle's not torn through. And they take longer. They take between 20 and 60 days. Most people will recover, but again, it can take longer for some people. And grade 3s are the most severe ones. They either are full, they class them as a grade 3 if it's more than 85% of the muscle that's torn through, or an avulsion injury of the tendon. So it means the tendon totally detaches from the attachment at the sit bone. Now, they don't necessarily need surgery. They don't often, in fact, need surgery. They only do surgery for the ones that detach if the separation is more than 2 to 3 centimeters. Because if it's less, it can actually grow back together very well, as long as you protect it properly. What I will say is there's a difference between adults and children. Adults will more likely tear the muscle belly and things, whereas children, because they have cartilage where the tendon attaches into the bone, they can often pull it off that. So if a child gets a hamstring strain that's painful right into the bum, it's really good to have it checked out by a physio or doctor, because there is a chance that it can be an avulsion of the tendon. Good, so that's what you can expect of healing times. Then, where are we going with this? Where's my next one? Symptoms. Hamstring strains develop a sudden sharp pain. And often people go, oh, I've just pulled something. Now, if it's a grade 0, they can often continue to play. But if it's anything more than grade 0, they'll come off the pitch and go, yeah, I can't run on this. I will also say if you do pull it, it's better not to play if you can get away with it, because you're more likely going to make that injury worse. Because remember, as soon as you injure it, you get pain inhibition of the muscle. So the muscle goes, yeah, I'm not going to work, I'm going to sleep. Plus, if you've torn some fibers, that muscle now is weaker than what it was a minute ago. So it's easier to strain it even further. So by continuing to play, you may think you're brave and you're good for your team, but you will make your injury more severe, and it may take you longer to come back. So really consider whether it's worth your while to continue playing. If your hamstring strain feels more like a crampy sensation, as if the hamstring wants to go, then what's starting to show in the research is that when they scan those guys, they often see a grade 0 with no issue in the muscle. So that type of thing is often referred pain either from the glutes or from the lower back or down to neural tension. So if it's not a sudden sharp pain that pulled you up, but it's more like a crampy feeling, it feels as if it wants to go, then have a look at all the other things that can refer into it. Often something my patients will tell me is that they had that crampy feeling for a while and then suddenly it did go. So yes, if you ignore that crampy feeling, because the muscle's not working properly, you can get a strain from it then if you continue to train on it. The pain varies with grades. So grade 1 and 2, grade 0 and 1 is painful usually when you use the muscle, but more often not when you're resting it. Anything above a grade 2 or grade 2 and up may even be painful when you're resting it. Bruising, you'll notice I've said there yes and no. You'll have bruising if you have bleeding, but only if the bleeding is not contained within the sheath of the muscle. All our muscles have nice thick fascia sleeves around them, and if it bleeds in there, whoops, I've got a dog coming in, sorry, come on, Kenny, out you go. Up. Sorry about that. If it bleeds within the muscle and that blood is contained within that sheath, you won't see the bruise, because to see the bruise, the dead blood has to come to the skin. So in that case, you may feel that you feel like a sausage in your muscle and quite a hard part there. Now, please don't try and massage that out, because you will make that injury worse. But I'll talk to you about that in a minute as well. With swelling, again, yes or no? If it's a severe tear, definitely you'll have some swelling. If it's not that severe, you may not notice swelling. It depends also on how well defined your legs are. If you're like me and you've got a nice layer of fat between your skin and your hamstring, you won't necessarily see swelling if it's a small injury. But if you're well defined, you may notice that better. Another point on the bruising and the swelling is, don't think where you see the bruising or the swelling is where the injury was. Because remember, that blood or fluid is sitting there and gravity just gradually pulls it down. So it will often show it lower than what the injury really is. Then a dent in the muscle. If you tear a significant amount of muscle fibers or number of muscle fibers, you may see a dent in the muscle. But again, more often than not, you won't, because a lot of us have quite a layer of fat between our skin and the muscles. So if you're really well defined and you've torn a significant part of a superficial part of the hamstring, you may feel a dent or you may see a dent, but otherwise you won't. Stretching that muscle that's injured will hurt or often hurts, and contracting it against resistance also hurts. With regards to that, if it's not a big tear, you will have to contract it really hard before you feel the pain. Whereas if it's a significant tear, only a gentle contraction, just lifting your heel up to your bum, can even hurt. So depending on the grade, the contraction may be more painful or less painful. Then if we look at treatments. So to treat a hamstring, and to be honest, any other muscle strain, you look at the stages of healing. We've got 3 stages of healing, and again, they are not clear-cut on this day, this one stops. They often overlap and work together. So the first 3 to 5 days of a muscle injury is the inflammatory phase. Now, as soon as people hear inflammation or inflammatory, they think whack anti-inflammatories on there, stop the inflammation and we'll heal the injury. That is not the case. You need inflammation to get rid of the debris in the wound. So remember, you've now injured something in there. There are cells that's damaged. Those cells needs to be taken away, and the inflammatory cells come and they literally eat them up. So you need that inflammatory process to help your healing response. The other important thing with that is that, yes, sometimes the inflammatory response can be over the top, and then that can cause more damage. So it is useful to calm it down a tiny bit, but not totally. And I'll get into that detail in a minute a bit more. Second phase is your regeneration phase. And it's exactly what it says. You're regenerating, you're producing new cells. But the new cells you produce are not strong yet. They're quite weeny little cells, and they're not, for cells to be super strong, they have to be aligned, the fibers, especially the collagen fibers, has to be aligned in parallel. When they first develop, they're a little bit like spaghetti. So they've got to be realigned through careful exercise, and then these weeny little ones needs to be strengthened. And if you think of it, how does one strengthen a muscle fiber? You go to the gym and you do strength training. But you don't jump in with heavy things. You start low and you carefully work your way up. And again, I'll talk about that a bit more in a minute. Now that phase lasts roughly for 2 weeks, but it can last longer if it's a significant injury. So it's not a clear-cut thing. And then the remodeling phase is what I just spoke about. During the remodeling phase, this scar tissue now has to become strong. So you've got to get your fibers aligned parallel. You've got to get your muscle fibers nice and strong again. So everything has to become like it used to be. And that's the remodeling phase. And depending on the tissue you injured, this can take quite quickly if it's just muscle fibers. If you injured the tendon, that will take longer because collagen and things takes longer to reproduce. And you know what? Of course, you're never going to know exactly what phase you're in because you can't look under a microscope every time and see, oh, okay, how are we doing with the healing process now? And you don't need to. As physios, we know where you are or what's right for you is we do specific tests and we see, can you do this thing? Yes, you can. Let's do that as an exercise. Once you tick this box, we'll move you on to that one. So we've got all these things in our heads where we've got things that you've got to achieve before we progress you onto the next level. Okay, so be careful because I often get emails from patients who say, or people who say, I've injured this, I've gone on the internet, I've seen these are the exercises you should be doing, I've started doing them, but my injury feels worse. And it's because, yes, those are the exercises you should be doing, but not at that stage of healing. So you've got to do the right exercises for the right stage of healing and for the right level of strength your muscle or your tendon is at. So if we then go on to treatment. Now, inflammatory phase. That starts from the moment you injure yourself. And your first treatment is PRISM. So PRISM stands for protection. And that comes down to, if you pull your hamstring, do not continue to run because you will make the injury worse. And especially in the first day, we're trying to limit how much bleeding happens inside that wound because as it bleeds, the pressure builds up and that pressure can cut off the blood circulation to the adjacent cells, the ones that's not injured. Now, if you suppress the circulation to them for long enough, they will die off because they don't get enough oxygen. So you will actually increase the extent of your injury. Same goes for swelling. If you really keep on moving on it, keep on running on it, you'll increase the amount of swelling you get. Again, increasing the pressure and again, potentially increasing the extent of your injury. So protection is really important for the first day or so. Same comes with rest. So I always class protect within the first day, then rest within the next 4 days or so. But rest comes with I like to make it relative rest. So you're resting from the activities that really aggravates it, but you don't just go lie on the bed. You're allowed to walk. You're allowed to go gentle cycling or swimming as long as it doesn't cause pain in that area. So for instance, if we think of swimming, if you put a pull buoy between your legs, you can still swim, but you're not kicking with your legs really. So rest means rest it from aggravating activities that uses the hamstring, but don't total rest. Ice can be extremely useful, especially at the beginning, to get the blood vessels to close up so that you don't get that bleeding, so that you can stop the bleeding as soon as possible. So if you've got any muscle injury, whack an ice pack on that as soon as you can. Now, on that point, you don't just want to leave the ice on there, because if you're going to leave ice for longer than 10 minutes, you may get the opposite effect. What happens is, the first effect of your body to cold is, oh, that's cold, we're going to lose our heat, let's close the blood vessels down. But now, if you leave it on your skin for too long, the body goes, oh, that's now getting too cold, we're going to get damage from the cold, I need to warm it up. So what does it do? It opens the blood vessels up again. So now you're getting more bleeding again. So that's why you only put ice on for 10 minutes. You take it off for 10 minutes so that it can cool down, or the skin can warm up a little bit. But then you can reapply it for 10 minutes, because then you get more of a cooling effect deeper down again. So don't just leave it on there for more than 10 minutes. Okay. Also, make sure that you always protect your skin, that you put a wet cloth or something between your skin and the ice pack. Otherwise, you can burn yourself. And the ice, for me, goes hand in hand with compression, because it's a handy time to apply that. Now, again, be careful with compression. Compression does not mean as hard as you can, you wrapping something around it. Because if you do that, you're also going to cut off your blood circulation, and you're actually going to stop the healing process. Compression has been shown to be most effective if it's just firm. So think of it as a nice bit of a hug. Okay, it's not a press, it's a bit of a hug. And one of the easiest way to do that is, if you've got your ice pack on there, just take one of those elastic bandages and just firmly wrap it around that. So it keeps the ice in place for you for 10 minutes, then you can take it back off and do the same thing again later, 10 minutes later. Elevation. Elevation for the hamstring is a little bit difficult, because if you're going to put your feet up, you may stretch your hamstring, and we don't want that because you'll make it worse. So what I would suggest is lying flat on a bed or flat on the floor and just having your legs slightly up on pillows or something, or just bend your knees up if that's comfortable. But don't have them straight up in the air, because that will stretch your hamstring again. Why is elevation useful? Because it makes it more difficult for the blood to get to the injury. So you're not getting, so it stems the bleeding a little bit, so you can decrease the swelling and things through that. And then the M stands for movement. And at this stage, the first day, don't be too hectic with the movement, but from day 2, start doing your free active range of movement. So what that means is, you don't push through pain. You literally, for the hamstring, it will be things like just gently swinging the leg, just getting that going, and just gently bending and straightening the knee so that you get it working a bit. But none of this is done into pain. You do it short of pain, and what you'll find is, the more you repeat it just short of pain, the easier it becomes, because the circulation gets better. If it really aches after you've done it, you've been too rough. You've overdone it. You need to be gentle with it. Okay. Or the nose. Please don't stretch it. Hamstring strains and muscle strains are stretch injuries. So you've torn muscle fibers. Now stretching them apart, stretching that new wound apart, is not going to do it any favors. I know it feels tight, but it's feeling tight because you've got bleeding and swelling in there. As that resolves, you will get less tight in that area. Okay, so stretching is a no-no, at least for the first 2 weeks. Then it can be slowly introduced. Massage, same thing goes for massage. No massage. I know you may think that you're helping the lymph drainage and things even during that period, but it could just be too strong for it. So stay away from massage. If you're doing it yourself, only start doing it after about 2 weeks. If you're going to a massage therapist and they experience one, they should only they can do very light massage from after the first week, but digging into that muscle and doing firm massage should really be left for 2 to 3 weeks after the initial injury. That's why I find dry needling can be a little bit more useful, Again, not really for the first week, but after that, because you can get the muscle tone to decrease, but you're not causing more injury to it. Alcohol, especially on that first 2 days of injury, do not drink alcohol. It thins your blood. It makes wounds bleed more, so you're going to increase your injury again. Also, alcohol actually decreases your healing response. So if you do drink alcohol, you're going to take longer to heal. On that note, I should have put nicotine on there. If you're using nicotine either through cigarettes or patches or vaping, that dramatically decreases regeneration of new cells. So you're not going to form as many new cells as quickly as somebody who doesn't take in nicotine. Do not put heat or contrast therapy on that. Again, I cringe when I see people put contrast therapy on new injuries. The idea behind contrast therapy is that you've got cold, then heat, then cold, that you follow up on each other. And the idea is to increase your circulation. Now, we want to decrease bleeding. So if you're going to increase circulation to that area within the first 2-3 days, you're going to make the injury worse again. So contrast therapy can be very useful, but leave it at least, I would say, 3 days before you start that. For the first 3 days, only stick with your ice. Okay. Then I've spoken about the movement, the free active movement. Another thing that can be really useful is isometric contractions. And an example of that I find people can tolerate quite well is the double leg glute bridge. And the idea there is that you just start getting a nice gentle contraction in the muscle, but it should be pain-free or very minimal discomfort. If you can just feel it, happy with it. If it's uncomfortable and painful, not happy with it. Leave it. Just do your gentle range of movement. But yes, and with isometric contraction, we mean that you go up into that position and you hold it there for several seconds. Okay. Then medication. Now, because it's painful, people often want to take medication for this. Definitely do not take any steroids or corticosteroids. Okay, so that means you don't swallow any corticosteroid tablets and you don't get any injections. Steroids dramatically decrease your healing response, and you will get a poor healing response from that. Anti-inflammatories, there's a little bit of controversy, is that even the word? In the literature at the moment, with some studies showing that if you use anti-inflammatories during the first 5 days of a muscle tear, that you may not get such good healing, and they think that is because it suppresses the inflammatory phase so dramatically for so many hours that it actually stops the healing from taking place properly. But there are also research studies that shows that doesn't make a difference. So I would use it with caution. I wouldn't actually use it unless it's needed, unless you have a massively overreaction of the inflammatory reaction. But if it's just painful and a bit swollen, rather opt for paracetamol, because that doesn't seem to affect your healing response. Remember, when it comes to tablets, always check with your GP before you take any tablets, because I'm not a medical person and you may have conditions that doesn't work with paracetamol even. So do check before you take any tablets. And only take it if it's needed. If it's just uncomfortable, I'd rather you be uncomfortable in the day, because then you're not going to overdo things. If it's stopping you from sleeping, then it may be worth taking tablets, because you do need a good night's rest. Ultrasound, what the current guidelines say is it's useful, but not within the first 24 hours, because within the first 24 hours, it can actually stop you producing some of the things you need for healing. So your, what's the RNA? Anyways, it comes down to growth factor is decreased. Laser therapy can be very good throughout the stages of healing. It's been shown to help you regenerate more cells more quickly, and it also just calms the inflammatory reaction down. So if you've got an overreaction of inflammation there, laser therapy can help to calm it down. I'm not sure if you can buy lasers on the internet these days. I'm sure I've had patients say that they have. But most physiotherapy clinics do have low-level laser therapy these days. So that can be useful. But in my experience, the first part of what I've discussed, the protection, the gentle movement, the gentle exercise, those are the things that makes the biggest difference in getting it better. The laser and other things are just a nice to have if you can have it, but you don't see a dramatic change with that. Then, if we move on to the next stage. So we're out of the first 5 days. This wound has now settled down. It is now ready to start regenerating new cells. So remember, during this stage, the new cells form. They're not strong yet. They're not aligned correctly. So through the next few weeks, we've got to give it exercises to realign these muscle fibers. And you do that through just using the hamstring. And also gradually rebuilding the strength because this muscle will be weaker. Now, we often start with isometric exercises like I've shown you first because they are really low load on the muscles, but you get a good endurance effect from that, and it's a good way to just start stimulating it. Then you move into introducing more concentric exercises, which is where the muscle shortens. So that'll be typically, wait, I've got some images, don't I? That is not a concentric exercise. We're going to have to move on to, that's an eccentric. This is what I was looking for. That's a concentric, so leg curls, but gentle leg curls at the beginning. And you don't have to go to the gym. You can use an elastic band for it. This is a good example of an exercise that involves eccentric, but also isometric, because you can hold that deadlift position. And this is for the later stage rehab where you've got your eccentric movements. So that's a great eccentric exercise where the muscle has to lengthen while it's contracting. And Nordic curls are really, really hard, and they've been shown to be good for injury prevention as well in the future, where you've got to slowly lower yourself down. But that's definitely end stage rehab and more for your top level athletes to introduce earlier. You also need some help with that. But there are loads of ways that you can do it on your own at home. So the single leg deadlift is a good one, but you start with double leg deadlifts, of course. This one is a great one you can do on your own, but I usually only introduce that after I've had people doing high bridges with their feet on something and also single leg bridges that we know they've got the base strength. So with all of these exercises, it's about not just jumping into doing any old ones, but starting low level and then slowly building it back up. Also, you've got to strengthen your core and pelvic stability. The hamstring muscle attaches, like I said, to your ischial tuberosity, your sit bone, which is part of your pelvis. Now, can you see that if the pelvis tilts forwards, that's going to affect the hamstring because it pulls it up, and if it tilts backwards, same thing. So when we run, there is some evidence out there or suggestion that if we've got a pelvis that's not, or core stability that's not great, you may get excessive movement of the pelvis, and that can cause the hamstring to strain. So, and the nice thing about core stability exercises and pelvic stability exercises is that you can start off with doing quite strong ones for those while you're still having to do pathetic ones for the hamstring. Because they don't necessarily, if you choose them well, they won't affect the hamstring directly while you're training them. Glute strength, extremely important for the hamstring. Because if we think about it, the muscles that extends the hip as we run, we've got the glutes and we've got the hamstrings. So if the glutes don't do their work properly, or they're switched off because you've got a back injury or something like that, then the hamstring will take more strain, and that can cause it to overstrain as you exercise. Be careful with stretching. You can start introducing stretching towards the later stages of your rehab, so week 3 to 4, but very gentle, not forceful stretching. The tightness you feel in that hamstring will decrease as it becomes stronger and as that injury heals. So don't think that you have to stretch it. Okay. Neural tension, spoke about that earlier. If you do test positive for neural tension, it's really useful to loosen off the lower back and the glutes first before you go into trying to do any hamstring stretches or stuff, because they will just not work if the nerve is still stuck. And then we gradually increase activity. So you usually start with light things like pool running or running on a anti-gravity treadmill where you don't put all your weight through it, or cycling on a stationary bike where you're using the hamstring but it's not that strong. And then you progress that to running drills outside. Now, if somebody's got a grade 0 tear, they can often progress to running drills within a week. If you've got a grade 2 tear, that may be 4 to 5 weeks down the line. It all depends on how well you get your strength back. And that's again why it's useful to work with a physio, because they can really strength test you and decide, right, you've ticked all the boxes, you're ready to start running now. Now with running drills, what I mean with that is you can't just go from not running at all to doing a little jog and then playing a football match, because you will re-injure it, because it may be strong enough for the exercises you did, but the only thing that gets it strong enough for sprinting is slowly building your running speed up to sprinting speed. Okay, so what you've got to do is you start with slow run, walk or jog drills. Then you usually go into more slight accelerations over time, and then eventually you go into full accelerations. And depending on what type of runner you are or what sport you are, you may add in strong running or fast running, or you may just be building volume first. It will all depend on your sport that you do. If you're a jumper, then you would start with double leg jumps and double leg hops, moving on to single leg ones and different heights of things you hop onto or over before you get into full jump training, which leads on to the sport specific stuff that depending on your sport, there will be specific drills that you've got to do before you can go back to full competition. So for footballers, you'll have to be able to change direction quickly. You'll have to be able to kick a ball really hard. All of those things need to be built into your rehab program. Excellent. So that's that. Let me know if you've got any questions. If you need any more help with the injury yourself, you're welcome to consult me via video call. Link is to my website is in the description of this video. The nice thing about the video calls is I can see you move and I can make you do all the exercises in front of the video so that I can develop the best program for you. But yeah, let me know if you've got questions in the comments and have a good day. Bye bye.